Hello everyone, I'm Dr. Michelle Yoshimoto. I currently work in an ophthalmology practice in Los Angeles. Just earlier this year, I completed my contact lens residency at Midwestern University in Arizona. Today, I'd like to share a case where we managed exposure keratopathy with scleral lenses. Causes of EK include a long list of conditions varying from neurological and neurotrophic diseases to lid abnormalities from trauma. These patients can be on one or multiple of these treatment options, depending on the severity of their condition. In review, standard treatments like aggressive lubrication with artificial tears may be burdensome to the patient and not always practical. On the other side, sessorrhaphy and weight implantations involve surgery, which can change the cosmesis of the patient and be a daunting option. So what next? With the recent surge of scleral lenses, studies have explored the implications of sclerals for management of ocular surface disease. These studies show promising outcomes that indicate improvement in VA, visual function via OSDI survey scores, and corneal staining signs. This highlights the adjunct role that sclerals can have, especially in those patients who have failed traditional therapies. As we may be familiar, scleral lenses are large diameter contact lenses that fall over the cornea and land on the sclera. They are typically used as a form of optical correction for corneal irregularities, but are also indicated in managing ocular surface diseases. The design of scleral lenses work as an advantage in treating exposure keratopathy. The rigid gas-permeable material serves as a physical barrier to protect the cornea. The fluid reservoir between the lens and the cornea serves as a constant liquid bandage to heal underlying persistent epithelial defects. Now we'll move on to our case. The 49-year-old Caucasian female presents in our clinic seeking a second opinion in managing the ocular surface of her left eye. Due to her medical history of cancer and meningioma, she had a craniotomy resulting in lagophthalmos and proptosis. As a result, she suffers from chronic exposure keratopathy and severe dryness that burdens her with an extensive medication regimen consisting of artificial tears every hour, ointment several times a day, moisture goggles, and lid taping at night. Her incoming corrected VAs were 20/20 in the right eye and significantly reduced in the left eye at counting fingers at 2 feet. In external examination, we note a proptosis with inferiorly displaced left orbit due to the metal plate that was installed at the back of her orbit. Via slit lamp, right eye is unremarkable, but the left eye findings include a dense stromal scar with an inferior feeder vessel located just below the visual axis. There is punctate staining at the scar's apex, with diffuse cornea staining localized in an interpalpebral pattern consistent with an incomplete blink. Here we have external photos of her left eye that demonstrates the extent of scarring and neovascularization. The corneal surface was highly irregular due to epithelial decompensation and areas of past ulcerative events. A scleral lens fit was initiated with the goal of providing the patient symptomatic relief and reduce her dependency on topical meds. Secondary goals included improving the corneal physiological health and restoring some functional vision. Consistent scleral lens wear yielded improvement in her vision over time, and she was elated to report improved functional vision in her daily activities, like looking at the food she was eating, seeing the contour of her hand, and therefore she reported an enhanced quality of life. This slide helps illustrate the great impact that scleral lenses have in improving corneal health and also signifies the power of external photography to monitor changes over time. On the left, we have a baseline photo that documented her left eye prior to scleral lens use, followed by a photo of her right eye after about 2.5 months of wear. Comparing these photos, we can appreciate the density of both the scar and neovascularization slowly regressing as the cornea was able to heal, and that is consistent with her gradual improvement in VA. As demonstrated in this case, scleral lenses serve as a successful and effective long-term solution for exposure keratopathy. A 5-year retrospective review analyzes medical records and patient surveys to quantify the viability of scleral lenses in their management of ocular surface disease. The results found promising outcomes, with the majority of patients successfully completing a contact lens fitting and continuing to wear their lenses beyond multiple years. Most patients achieved their treatment goals, defined as improved comfort and resolution of keratopathy. Another beneficial outcome was improvement in their VA. As a chronic condition, exposure keratopathy can be debilitating to the patient's ocular health and quality of life. There are many treatment options available, but it is important that we identify features unique to each patient's case and individualize a treatment plan to meet their goals. As seen with our patient, scleral lenses can elicit an immediate reaction of relief. It is a great way to quickly make a remarkable difference in our patients' lives. And with that, thank you for tuning into this video. I look forward to reuniting in San Diego for the Academy.